8 years ago, there was a resident named Marshall Wiesner who was in our medical education pathway. During his residency, we had our senior teaching session and our intern teaching session. They were on the same topic every Thursday. So Marshall thought this is a great opportunity to incorporate spacing, so put adult learning theory into the senior resident teaching session. So let's move the topic for the senior teaching session a week before the half day. So this gives our senior residents an opportunity to learn about the subject, then go and teach their team in preparation for half day the following week. And thus Wiesner Prep was born. It was renamed, which it still is to this day. And Marshall Wiesner is a GI attending here at UC. But when we have these Wiesner Prep sessions, we don't cover the exact same content that we cover with our interns, even though it's overall the same topic. And this is what I think makes Wiesner Prep so special. It's about an hour long each week. It's every Thursday before a half day. It's led by a chief resident. And what makes it special is how we design the learning objectives for the session. We use something called Bloom's Taxonomy, so this is this hierarchical model of learning objectives, and as you get higher up in the pyramid, it indicates an increasing level of complexity of a concept. So when we're designing the learning objectives for these Wiesner Prep sessions, we're really trying to hit the top tiers of Bloom's Taxonomy. Because if you think about it, what a senior resident is expected to know and needs to know about cirrhosis is vastly different from what an intern is expected to know or needs to know. So the content that we cover in the topic is really aimed at that. So we're not just having our seniors, recall basic facts about a disease process or understand basic pathophysiology. We're having them evaluate and critique the most up-to-date literature on the topic. We're having them compare and contrast management patterns. That's really hitting at these top tiers of Bloom's Taxonomy that indicates a deeper understanding of the topic. It's by far one of our most well-attended conferences. Our senior residents show up every week. They're just so engaged. They're so excited. We have such phenomenal conversations, engaging conversations, and I think it's really a highlight of not only our attitude and the culture of education at our program, but how we take these key concepts in adult learning theory and really put them into practice when we teach our residents.